management noticing. Not in her house. Notice that Miss Rydell is wearing her signature diamond neck brooch. This is to remind you of a slow-growing, rock-hard, fixed, and painless neck mass or goiter. And remember, fibrosis extends outside the gland. This can cause hoarseness if the recurrent laryngeal is involved, as well as wheezing and dyspnea if the trachea gets compressed. Now, about symptoms. The majority of patients with Rydell's thyroiditis will actually have normal thyroid hormone and TSH levels at presentation. About a third of patients, however, will have subclinical or overt hypothyroidism, hence the untied thyroid tie worn by the dealer. And remember what this looks like on labs. That henchman in the back there is tightening that bow tie to remind you of elevated thyroid-stimulating hormone from the pituitary, and either depressed T4 levels or normal-ish T4 levels if it's more of a subclinical picture. We've also laid out a few antibody cards on the table to remind you that about 2/3 of patients have elevated thyroid autoantibody concentrations. These autoantibodies are probably not causing destruction like they were in Hashimoto's thyroiditis. Remember measuring those anti-TPO and anti-thyroglobulin antibody titers? Instead, these antibodies probably form in response to thyroid antigens released while the thyroid gland is getting destroyed by that cellular infiltrate. All right, poker not your thing? Looking for higher stakes with even less skill involved? Let's head over to the craps table, where we'll meet our next inflammatory thyroid disorder, Ducker-Van's thyroiditis, more appropriately called subacute granulomatous thyroiditis. In this case, the itis is caused by granulomatous inflammation of the thyroid, which shows up on histology as widespread neutrophilic and lymphocytic infiltration of the gland. This is depicted by the blue chips scattered across the craps table, kind of like all the little blue nuclei of inflammatory cells crowding the tissue. To remind you of granulomatous inflammation specifically, we've drawn in a few cages of chips on the side of the table, a collection of macro cages, if you will. Our recurring symbol for granuloma formation. Granulomas are discrete areas of inflammation comprised of helper T cells surrounding a mosh pit of hyperactive macrophages. You may even spot a few multinucleated giant cells in the center, depicted here by the groups of pink cellular-looking dice. Think of each purple dot as a nucleus inside the giant cell. Subacute thyroiditis is most commonly seen in women 30 to 50 years of age, and is believed to be caused by an inflammatory autothyroiditis following viral infection. Because it's strongly associated with HLA-B35, it's thought that a viral infection provides antigens to this MHC molecule, which then directs the immune system to attack the thyroid. Most patients diagnosed with subacute thyroiditis have a history of upper respiratory infection in the weeks prior to symptoms onset. So we have a middle-aged woman here blowing her nose. Just a typical URI. Or is it? She's given the signal. It's time for our next agent to make his move. Patients often present with an acute, painful goiter and may complain of difficulty swallowing or neck pain. In the acute phase, thyroid follicles become inflamed and burst, and release thyroid hormone into the circulation. This results in temporary hyperthyroidism, which can last between 2 and 8 weeks, symbolized here by the evil henchman flinging that T4 time bomb in the air. Foiled again. This can be followed by a hypothyroid phase lasting another 2 to 8 weeks, as depicted by the second henchman with an untied thyroid bow tie. The hypothyroidism is usually asymptomatic, and in most cases, there is complete recovery. All right, that was subacute granulomatous thyroiditis. It's time to introduce another transient autoimmune thyroiditis syndrome, called subacute lymphocytic thyroiditis, or painless thyroiditis, or even silent thyroiditis. Shh. Shh. I said shh. Painless thyroiditis is considered a variant form of Hashimoto's thyroiditis, the chronic autoimmune thyroiditis, which we met in the last sketch. Aha! Dr. Hashimoto, we meet again. Painless thyroiditis is considered part of a spectrum of autoimmune thyroid disease. It's kind of like the acute, transient version of Hashimoto's. Early in the course of disease, patients usually present with high serum concentrations of anti-thyroglobulin and anti-TPO antibodies, represented here by our agent's secret weapon. Those aren't baby rattles. Those are baby shurikens, antibody-shaped, to remind you of autoantibodies against the thyroid. The initial inflammation of the thyroid leads to a transient state of hyperthyroidism, as preformed stored thyroid hormone leaks out into the circulation. Patients typically present with painless, mild thyroid enlargement or goiter, as illustrated by the rattle held in front of her neck. This is sometimes followed by a transient hypothyroid state. Hence the next henchman there, with the untied bow tie looking a little worse for wear. This phase is usually mild or even asymptomatic, and a few weeks later, a return to normal thyroid function. All those little blue dots on her dress depict the typical lymphocytic infiltrate seen on histology with varying degrees of follicle destruction. Those circular areas represent germinal centers. That's right, B cells are differentiating right inside the thyroid. Recall that we saw a similar picture in the setting of Hashimoto's. A very similar transient silent thyroiditis is seen in about 5% of postpartum women within a year of giving birth. Hence the whole secret agent baby twist ending we threw in there. And just in case you needed extra convincing that painless thyroiditis is probably on the same spectrum as Hashimoto's, some patients will develop a chronic autoimmune thyroiditis many years after that initial acute transient episode. So to recap, remember that Riedel thyroiditis is characterized by fibrosis with extension beyond the capsule, leading to a rock-hard goiter and progressive hypothyroidism. Subacute thyroiditis, over at the craps table, is painful and often associated with a preceding URI. Look out for that classic progression: hyperthyroid, hypothyroid, and back to baseline. And on histology, look for an infiltrate of inflammatory cells, in addition to granuloma formation. And lastly, painless or silent thyroiditis at the bottom of the scene. Autoantibody destruction of the gland causes that classic progression yet again: hyperthyroid, hypothyroid, and back to euthyroid, with a transient infiltrate of lymphocytes seen on histology. All right, time to wrap up this thriller diller with a couple of drugs known to affect thyroid function: lithium, amiodarone, and
dun, dun, dun,
even iodine itself. Recall from Sketchy Farm that lithium is a drug used to treat bipolar disorder, and it's always represented with some kind of lithium lift, either a chairlift or an elevator of some kind. And in this scene, it's embodied by the escalator over towards the exit. Although the mechanism is not fully understood, lithium can directly inhibit the secretion of thyroid hormones, leading to hypothyroidism and goiter formation. Although less common, lithium can also increase the risk of developing hyperthyroidism. Also, you remember those Tres Amigos from Sketchy Farm? Amiodarone, a class 3 antiarrhythmic drug, can cause both hyper and hypothyroidism. It causes hypo by blocking the production of T3, blocking the receptor for T3, and by causing direct toxic injury to the thyroid gland. Additionally, amiodarone is 40% iodine by weight. Iodine, as crucial as it is to the formation of thyroid hormone, can also have an inhibitory effect on thyroid hormone production. This is known as the Wolff-Chaikoff effect, where excess iodine inhibits thyroid peroxidase, thereby preventing the organification of thyroid hormone. All right, I know it looks like this criminal organization is just falling apart from the inside due to the general ineptitude of all the members involved. But you know how this series goes. There's always a sequel. So for our next sketch, we're turning up the heat, to intolerable levels, in fact. It's time to go from hypo to hyperthyroidism.